Welcome back to Zaco. We've been quite busy preparing some new videos for you, and we've chosen to start with a very fundamental chapter in infection prevention and control, HAIs. Now you may be wondering, what is that? Well, HAIs, short for healthcare-associated infections, are a group of infections that have and continue to affect patients and healthcare workers globally. This topic will be a 5-part mini-course. So to continue this wonderful mini-course, be sure to subscribe to our channel and hit that notification bell to get updates on all our new videos. So without further ado, let's dive right in. First and foremost, what exactly are healthcare-associated infections? HAIs are infections that patients acquire during their stay in healthcare facilities due to exposure to harmful pathogens, such as bacteria, viruses, or fungi. Now, depending on the ward or area this infection develops in, the microorganism can be easily dealt with or can be classified as a superbug. Sadly, HAIs not only prolong hospital stays and increase treatment costs, but they also pose a significant risk to patient safety and well-being. The most prevalent types of HAIs include urinary tract infections, surgical site infections, bloodstream infections, MDROs, and pneumonia. While healthcare facilities strive to maintain strict hygiene protocols, preventing HAIs requires a collaborative effort from everyone involved: healthcare professionals, patients, and visitors alike. Catheter-associated urinary tract infections are infections in the urinary system that occur due to the use of a urinary catheter, more commonly known as a Foley's catheter. This catheter is inserted in the lower part of your urinary system, a part known as the urethra. Approximately 75% of HAIs reported to the National Healthcare Safety Network are CAUTIs. Approximately 15 to 25% of patients have urinary catheters inserted during their hospital stay. Prolonged use of a urinary catheter is one of the most common risk factors for developing a CAUTI. These catheters can introduce bacteria into the urinary system, leading to infections. Healthcare professionals use urinary catheters to drain urine from the bladder when a patient is unable to do so independently, either due to severe illness, operatively, and even post-operatively. CAUTIs can have severe consequences for patients. As with any bacterial infections, antibiotics must be given to patients who have developed CAUTIs. Remember, the antibiotics chosen depend on the microorganism found and which antibiotics they are sensitive to. So, CAUTIs do often lead to increased hospital stay, discomfort, and distress for patients. Moreover, these infections result in an additional burden on healthcare systems, increased healthcare costs, and increased antibiotic resistance. Any and every good healthcare facility should implement a set of practices to keep CAUTIs in check and to prevent them from occurring. After all, the best treatment is prevention. The set practices are collectively called a care bundle. A CAUTI care bundle involves all the practices needed to prevent a CAUTI from occurring. Let me introduce you to the most common preventative practices. Proper hand hygiene is crucial. It's vital for healthcare professionals to wash their hands thoroughly with soap and water or use hand sanitizers before and after handling the urinary catheter or touching the patient's genital area. This simple step can prevent the spread of pathogens. For more information on proper hand hygiene techniques, please feel free to watch this video for a more detailed overview. Sterile techniques. When it comes to catheter insertion, healthcare professionals must follow a sterile technique. This involves using sterile gloves, sterile equipment, and a clean, disinfected environment. By maintaining proper hygiene during the insertion and care of catheters, we can reduce the risk of bacterial contamination. Appropriate use and size. Another vital aspect is the appropriate use of catheters and using the most appropriate size of catheters. Catheterization should only be considered when it's absolutely necessary, and the duration of catheterization should be minimized as much as possible. Supervising healthcare professionals should regularly assess the need for the urinary catheter and promptly remove it when no longer necessary. Inserting a proper size is also a fundamental practice to prevent CAUTI. A catheter that is too small may easily introduce bacteria into the urethra. A catheter that is too large can cause trauma to the urethra, thus leading to an open road for bacteria as well. Urine collection bag. Attention should also be given to the urine collection bag. It should be positioned below the level of the bladder to prevent backflow of urine. The bag must be kept clean, regularly emptied, off the floor, and not touched unnecessarily to prevent contamination. Common practices at home, specifically hygienic ones, must also be carried out in a hospital setting. Regular cleaning of the genitalia is necessary to prevent infections, including CAUTI. Unobstructed, closed flow. Maintaining a closed draining system, meaning from urinary bladder to urine bag, is another vital practice to prevent CAUTI. Ensuring that the catheter is not kinked or obstructed prevents further bacterial growth and possible backflow to the bladder. Finally, patient education. Patient education plays a crucial role in preventing infections. It's essential that patients and their caregivers understand the importance of infection prevention measures. Educate them on proper hygiene, their role in catheter care, and when to report any signs or symptoms of infection to healthcare professionals. Preventing catheter-associated urinary tract infections requires a holistic approach. By implementing proper hand hygiene, following sterile techniques, ensuring appropriate catheter use, maintaining urine collection bags, and educating patients, we can significantly reduce the occurrence of CAUTI. Thank you for watching this video. This is part 1 of a 5-part series on healthcare-associated infections. Subscribe to our channel to watch our next video on the second type of healthcare-associated infection, surgical site infections. We sincerely hope you enjoyed this video. Please feel free to leave any suggestions, requests, or questions in the comments section, or send us a message. To learn more about Zaco, visit our website, www.zaco-sta.com, or email us at admin@zaco-sta.com. WhatsApp or call us at +966 565 405 419 to reach our experts for assistance in accreditation matters such as SABI, JCI, or GAHAR. Follow us on social media, where we post tips, tricks, and motivation for you on a regular basis. Don't forget to subscribe to our channel to be notified of our videos when we post them. Zaco, the power of expert consultations in the palm of your hand.